Tingling, numbness, or that pins and needles sensation in your feet can feel strange, uncomfortable, and even scary at times. Maybe it happens when you sit cross-legged for too long, or perhaps you've noticed it occurs regularly without an obvious cause. While occasional tingling is usually harmless, frequent or persistent numbness in the feet can sometimes be a warning sign of an underlying health condition you shouldn't ignore. In this article, we'll uncover the shocking truth about what really causes that tingling or numb sensation in your feet. You'll learn the common triggers, serious medical conditions linked to numbness, and practical steps to relieve and prevent it. By the end, you'll know when to relax and when it's time to see a doctor. Before diving into causes, it's important to understand why feet tingle or go numb. Your feet are packed with nerves, blood vessels, and muscles that all work together to keep you balanced, mobile, and pain-free. When everything functions smoothly, you barely notice your feet at all. But when there's a disruption in nerve signals, how your brain communicates with your feet, or blood flow, how oxygen and nutrients reach your foot tissues, you may experience sensations like tingling, pins and needles, numbness, loss of feeling, burning or prickling sensations, weakness or heaviness in your feet. The medical term for tingling or numbness is paresthesia, and it can range from a minor inconvenience to a sign of a serious health problem. Not every case of numbness means you're in danger. Sometimes, it's simply your body's way of reminding you to move or adjust your position. Let's look at the most common non-serious causes first. 1. Sitting or standing in one position too long. When you cross your legs or sit awkwardly, you may compress nerves or restrict blood flow. This can cause temporary tingling or numbness that usually goes away once you move around. Think of it as your body's way of saying, "Hey, don't forget about me down here." 2. Tight shoes or socks. Wearing shoes that pinch or compress your feet, or socks with a tight elastic band, can reduce circulation and irritate nerves. 3. Temporary nerve compression. Activities like cycling, running, or even prolonged squatting can put pressure on nerves in your legs or feet, leading to temporary tingling. 4. Cold temperatures. Exposure to cold can narrow blood vessels, slowing circulation and causing your feet to feel numb until they warm up again. Backhand index pointing right. In these cases, tingling or numbness is usually harmless, short-lived, and relieved by rest, movement, or adjusting your footwear. Now here's the shocking truth. Frequent, persistent, or unexplained numbness in your feet can signal a serious medical condition. Since your feet are often the first part of the body to show signs of nerve or circulation issues, it's crucial not to ignore these symptoms. Here are the major medical causes you need to know about. 1. Peripheral neuropathy. Peripheral neuropathy is nerve damage that affects the nerves outside the brain and spinal cord, commonly in the feet and hands. Causes of neuropathy include diabetes. Diabetic neuropathy. High blood sugar damages nerves over time. This is one of the most common reasons for chronic tingling or numbness in feet. Alcohol abuse. Excessive alcohol consumption can lead to nerve damage. Vitamin deficiencies, especially vitamin B12 deficiency, which is crucial for nerve health. Toxins and certain medications. Some chemotherapy drugs, heavy metals, or antibiotics can harm nerves. Symptoms of peripheral neuropathy. Burning or tingling in feet, especially at night. Numbness or reduced ability to feel pain/temperature. Muscle weakness. Balance problems. 2. Poor circulation, peripheral artery disease, PAD. PAD occurs when fatty deposits, plaque, build up in your arteries, reducing blood flow to your legs and feet. Warning signs of PAD. Cold, numb feet. Cramping or pain when walking, intermittent claudication. Slow healing sores on your feet or legs. This condition increases your risk of heart attack and stroke, so persistent numbness from poor circulation should never be ignored. 3. Sciatica or nerve compression in the spine. A pinched nerve in your lower back, sciatica, can radiate pain, tingling, or numbness down your leg into your foot. Causes include herniated discs, spinal stenosis, degenerative disc disease. 4. Multiple sclerosis, MS. MS is a neurological condition where the immune system damages the protective covering of nerves. Numbness or tingling in the feet is often an early symptom. 5. Stroke or transient ischemic attack, TIA. Sudden numbness or tingling in one foot, especially if combined with weakness, slurred speech, or facial drooping, may indicate a stroke. This is a medical emergency. Call emergency services immediately. 6. Infections and autoimmune conditions. Shingles can cause tingling or burning before the rash appears. Autoimmune disorders like lupus or rheumatoid arthritis may also affect nerves. 7. Medication side effects. Some blood pressure drugs, chemotherapy agents, or antibiotics list numbness/tingling as possible side effects. Many people brush off tingling or numbness, thinking it's just circulation, or that it will go away. But here's the truth. Diabetes-related nerve damage, neuropathy, is irreversible. Once nerves are damaged, they cannot be fully repaired. Catching it early is critical. Poor circulation can lead to amputations. In advanced PAD, untreated blood flow issues can cause tissue death. Nerve compression worsens with time. Conditions like sciatica or herniated discs may progress to permanent nerve damage if untreated. Ignoring stroke symptoms can be fatal. Acting quickly can save your life and prevent long-term disability. The shocking part is not just that numb feet can signal something serious, it's that so many people ignore the warning signs until it's too late. Seek immediate medical attention if your foot numbness is sudden in onset, accompanied by weakness, slurred speech, or vision problems, possible stroke. Associated with severe pain or inability to walk. Causing loss of bladder or bowel control, possible spinal nerve compression. See a doctor soon, non-emergency, if you experience frequent or persistent tingling/numbness, symptoms that worsen at night, numbness spreading to other parts of your body, balance problems or frequent falls, diabetes or circulation issues with new foot symptoms. Diagnosis: how doctors find the cause. If you go to a healthcare provider, they may run tests such as blood tests, check for diabetes, vitamin deficiencies, thyroid issues. Nerve conduction studies or EMG, measure nerve and muscle function. Imaging scans, MRI, CT, X-ray for spine or circulation issues. Ultrasound/Doppler, check blood flow in your legs and feet. Treatment depends on the underlying cause. Some common approaches include: for peripheral neuropathy, control blood sugar for diabetics, vitamin B12 supplements if deficient, medications for nerve pain, gabapentin, pregabalin, duloxetine, lifestyle changes, quitting alcohol, improving diet, for poor circulation PAD, lifestyle changes, quit smoking, exercise, healthy diet, medications, cholesterol lowering, blood thinners, procedures, angioplasty, stenting, bypass surgery in severe cases, for nerve compression, sciatica, herniated disc, physical therapy, anti-inflammatory medications, corticosteroid injections, surgery if conservative treatments fail, for MS or autoimmune conditions, disease-modifying therapies, physical rehabilitation, pain and symptom management, lifestyle changes to prevent tingling and numb feet. Even if your tingling is temporary, taking care of your nerves and circulation now can prevent future problems. Practical tips: exercise regularly, walking, swimming, or cycling improves blood flow and nerve health. Maintain a healthy weight, reduces pressure on nerves and improves circulation. Eat a nutrient-rich diet. Focus on B vitamins, omega-3s and antioxidants. Avoid smoking and excessive alcohol. Both damage nerves and circulation. Wear supportive footwear. Prevents unnecessary nerve compression. Check your feet daily if diabetic. Look for wounds, sores or infections. That tingling or numb sensation in your feet may seem harmless at first, but it's your body's way of waving a red flag. While sometimes it's just a matter of sitting in one position too long, it could also be a sign of serious conditions like diabetes, poor circulation, nerve damage, or even a stroke. Backhand index pointing right. The shocking truth is that ignoring persistent numbness can lead to irreversible damage, disability, or even life-threatening complications. So listen to your body. If the tingling doesn't go away, don't wait. Seek medical advice and take action now.